Parkinson's is a complicated condition. Everybody's symptoms are different, and they change from day to day, hour to hour, and minute to minute. This makes it a very difficult condition to measure, to assess.
Clinical routine, we are currently measuring Parkinson's symptoms mainly with qualitative or at best with semi-quantitative methods. They are subjective and are only a snapshot of the condition.
Imagine what it would be like if we were able to monitor our own symptoms on a 24-hour basis. Then we could assess patterns in our own illness and adapt accordingly. Imagine how that would reflect with our clinicians. It would keep them more informed, and because so much of our Parkinson's remains hidden to them, how can they possibly know what our day-to-day experience with Parkinson's is like?
Being involved in clinical trials, one of the problems that we are facing is having the right tools to measure what really counts for patients. So the idea to develop a system that will evaluate pragmatically how patients feel really against things related with the health-being of patients at home.
And imagine what it would be like if we could pick up little nuances in our Parkinson's, so that in clinical trials we could more readily assess, more accurately assess how Parkinson's is progressing or hopefully regressing.
SenseBug will set a new standard for measurement of Parkinson's disease. At the moment it measures 6 symptomatic areas: walking, tremor, rigidity, sleep, balance and cognitive function. Most of the areas are measured in a continuous and objective fashion. The special and new thing is that SenseBug measures the disease in the home environment.
It's very important for us to get the views from the people with Parkinson.
SenseBug has developed a system that measures Parkinson's disease using a participatory approach. This means that the system is really based on needs and requirements of the persons with Parkinson's.
They are, so to speak, co-designers to create a better product.
Our task in this project is to develop the algorithms which hopefully extract useful parameters.
We measured the dyskinesia and bradykinesia score of patients, and it was very interesting to see how the final outcome of our algorithms really correlates to what you can see in videos about the patients.
We have sensor data, they are very objective, cognitive tests, personal recorded details like own written text, like how I feel today, and not forget the medication as a very important thing to all.
Without better measurement in Parkinson's, we can't expect a better quality of life, because we can't monitor our own symptoms, we can't communicate effectively to our clinicians, and we're not going to have sufficiently accurate measurement in clinical trials to produce treatments that will improve our Parkinson's. SensePark is going to change all that. SensePark is about to revolutionise how Parkinson's is measured.